Coming up, we'll be on location at Optimal Physical Therapy and Rehab in Silver Spring, Maryland, discussing the benefits of physical therapy and how they can effectively treat pain and improve your function with two of this area's top physical therapists, Paula Warnsman and Hadassah Roberts. Welcome, Paula and Hadassah. It's a pleasure having you on our program.
Thank you for having us.
It's your first time, in fact, on the Top Doctors interviews. We have a lot to talk about. We have some patients that we're going to be speaking with a bit later. But I wanted to begin, if I may, with you, Paula, by having you tell us what physical therapy is for those who may not know.
Okay, well, physical therapy is by far the greatest profession. But what we do is we work to get patients to where they were functioning before. We work to decrease pain and increase motion, increase strength, and get them feeling better to where they can start playing sports or, do recreational activities or back to their regular lifestyle.
And Hadassah, wanted to follow up by asking you, what types of conditions does physical therapy address?
Oh, there are many. We treat things like even headaches. We see a lot of patients post-surgical, whether it be rotator cuff. We've seen like ACL injuries, post-op lumbar injuries like back pain.
We also treat a lot of everyday injuries like tendinitis or repetitive injuries, or even simple strains like if they slip and fall and break their wrist, or ankle injuries as well, like ankle sprains.
How do you diagnose and determine which specific treatment will work best for each patient and how they can improve through that?
Well, when a patient first comes to us, we do what we call a physical therapy evaluation. So we'll take a look at their range of motion, their strength. We'll also look at joint mobility, and the key a lot of times is the special tests, which kind of helps us zone into exactly what's going on. And this is for more, patients that may have repetitive injuries.
So that determines what would be best to treat
as far
that
as treatment
particular
goes,
problem.
right? And based on our findings, then we come up with a treatment plan.
So you customize it for each patient.
Yes, definitely.
And Paul, I wanted to ask you what treatments you feel are most effective based on both of your vast experience and knowledge in helping patients through physical therapy.
So I wouldn't say there's one in particular. I'd say it's a combination of treatments. We do a lot of what we call manual therapy, where we do a lot of hands-on. So whether it be stretching or soft tissue mobilization, or even what we call joint mobilization.
And Hadassah, I wanted to ask you if you can please describe a typical physical therapy treatment and how that works.
Depending on our findings on the initial evaluation, we'll do manual therapy, and we'll also do some exercises, again addressing strength deficits, flexibility issues, joint mobility issues. If we have back patients, we focus a lot on stability, core stability, and we usually do modalities also for pain control. So we may at the end with electrical stim and maybe cold pack or moist heat to kind of help decrease the symptoms. Though it's temporary, but it gives the patient some pain relief.
And Paula, I wanted to ask you, what type of results can patients expect to see from the physical therapy treatments?
Well, mostly they just feel better, and that's the goal, is we want them to feel better. After the evaluation, we try to make sure that we hit the goals that we've created on the first day, whether it be increasing their strength or increasing their motion, being able to walk up and down stairs without any pain, or walking down the street with no pain, or being able to go back to running or basketball, that kind of thing.
We're now going to meet some patients of Optimal Physical Therapy and Rehab here in Silver Spring, Maryland. Welcome, Lino. It's a pleasure having you on our program.
Pleasure being here.
We wanted to begin by asking you, Lino, if you can please tell us what problem or problems were you experiencing that brought you here to Optimal Physical Therapy and Rehab?
Well, initially what brought me to Optimal Physical Therapy and Rehab was a hand injury that I hurt myself playing basketball. I got rehab for it, and it was pretty straightforward, just a wrist sprain. And then I came back again because I hurt my ankle playing basketball. So my primary care physician suggested I get rehab, and I decided to come back to Optimal Physical Therapy and Rehab. And the staff here was very helpful with my injury. They allowed me to rehab it and showed me proper ways to strengthen my ankle.
And what type of treatments did you have done on that?
They did electro therapy,
Okay.
also stretching exercises, and also a strength training around the ligaments around my ankle.
So I take it it's back to normal now?
Oh, 100%.
Wonderful. Now, I wanted to begin, Jan, by having you please tell us about what brought you here.
In 2010, December, I had a major back surgery. I had a lumbar laminectomy and a spinal fusion.
What have the treatments been like for you?
Well, it's hard to say that physical therapy is fun, but it's fun because they're so much fun to be around. They're just, they're very professional, but they're lighthearted and fun to be around, happy people.
Makes it a lot easier going through it, right?
Right, and you're working as hard as you can work, but you're laughing at the same time because they're so much fun to be around.
Can you tell us a little bit about what was involved in those treatments?
There was, the heat treatment, that always was wonderful, and a series of exercises and using the weights, and then when I was rehabbing my toe, I had to practice walking, and I had to practice rising up and down on my toes, and everything seemed to be very useful and to the point and made a big difference for me.
Welcome, Tonya. It's wonderful having you on the program today.
Well, thanks for having me.
You can please tell us what problem or problems were you experiencing that brought you here to Optimal Physical Therapy and Rehab?
I tore my rotator cuff
Oh.
doing stretches over the door jamb.
Oh, boy.
And I knew I didn't want any kind of surgery. So my cousin said, well, I have a friend who has a practice. And we started working on it, and I'd say after about a month or so, and a little bit of massage after I did 10 sets of 30 exercises, I was starting to feel better. And I didn't have to have surgery. And my pain is manageable.
We're certainly happy to hear that, Tonya. I take it you're very pleased with the results thus far.
Very pleased, and I love the both of them. They're really fantastic people.
Welcome, Michael. Thanks for coming down.
Happy to be here, happy to be here.
I wanted to begin by asking you, Michael, if you can please tell us what brought you here to Hadassah and Paula.
Yes, I'm suffering from a herniated disc, and I was having some issues with mobility and things of that nature. So my doctor said, hey, why don't you check out these physical therapists? They're pretty good. See what we can do. So that's what started my journey here.
Okay, so then you came here, and what happened?
Came here, was met by these two very energetic, bubbly ladies who really challenged me and started putting together routines to help me, relief with all the pain I was going through.
Oh, and what were some of the treatments that you were going through?
Some of the treatments that they did was they worked on my core because they said that was the core issue of what was going on. They helped strengthen that with different exercises and helped with my mobility. And then at the end, put a little E-stim to make everything kind of ease out.
Oh, and how long did that process take for you?
The process day to day was about an hour and a half.
Okay.
And I would come 3 days a week. And then I was here for about 3.5 months.
Oh, and how do you feel now?
I feel great. I feel great. All the exercises they gave me, I still use outside of their practice. I still call in to check on them and make sure that I'm doing what I need to do, and I'm doing well.
And as far as the folks out there watching right now, any additional thoughts you'd like to tell them?
Hey, if you want to come to a practice where you are going to feel special and you're going to feel even more special body-wise afterwards, this is the place to be.
We're now back with Hadassah and Paula. Some very impressive results. The patients are very happy. They're recommending folks to come to you because of the results they've experienced. They're getting their function back. It's really, in Tonya's case, she's managing that torn rotator cuff because she at all costs didn't want surgery done.
Right.
And I think it really is something very powerful that you all are doing here in helping so many folks get their lives back.
Thank you.
Thank you.
Now we're literally out of time, but I wanted to ask you both before I let you go. You and your practice, Optimal Physical Therapy and Rehab here in Silver Spring, Maryland, have certainly achieved a reputation for excellence, not only in physical therapy treatments, but in patient care, as the patients earlier today attested to.
Right.
I just wanted to ask you what you both feel helps separate you and your practice apart from the others.
Paul and I are the two treating therapists here, and we, unlike many other facilities, I believe that they have a lot of technicians that do a lot of the work, and maybe they spend about 5 minutes or so with the therapist, where, again, we pride ourselves in really,
Doing a lot.
one-on-one attention with the patient.
And that's a significant point, absolutely. Here, when the patients come, they see either one or both of you.
Exactly.
And on that note, we'd like to thank you both for joining us, and we'd love to have you both back on in the future sometime.
Okay, thank you so
Definitely.
much.
Thank you
Thank
so
you.
much. Thank you.